So today's question is, what is physician burnout syndrome? Physician burnout syndrome is a form of occupational burnout. So occupational burnout results from work-related stress and constant physical and emotional exhaustion caused by punishing work schedules and intense working hours. So physician burnout is a form of burnout that's very specific to healthcare professionals. And there have been a few studies on it, and they've shown that healthcare professionals are generally at greater risk of suffering from burnout than those in almost any other occupation. Can you imagine the pressure that all of these healthcare professionals have, not only working hugely long hours under tremendous stress, but they often have to deal with life and death situations? I can't even fathom it. And then, of course, there's the huge amount of admin and paperwork that they have to do, all whilst being under constant pressure to see more patients in less time. So all of these factors, of course, then contribute to burnout. And the condition itself is characterized by emotional exhaustion, sleep deprivation, a reduced sense of personal accomplishment, a disconnect from emotions, so many things. And it can also manifest in feelings of detachment from patients, from family, from friends, or a lack of empathy towards patients as well, which can be especially concerning in the medical field, can't it? Where a sense of empathy and compassion is considered crucial to providing effective care. Very similar, in fact, to compassion fatigue. Not surprisingly, the condition is associated with an increased risk of medical errors and, of course, can also contribute to the onset of other mental health problems such as depression and anxiety. How do we prevent it? Well, I could give you the textbook stock psychologist answer, which is manage stress, improve well-being, take regular exercise, learn relaxation techniques, and so on. Or we can be realistic. We can fix the NHS by voting in a government that will actually invest in the NHS, invest in more nurses, more doctors, more infrastructure, higher salaries, and better conditions. After all, we spent a year clapping for them every Thursday at 8 p.m. But clapping doesn't pay bills. Clapping doesn't lower waiting lists. And clapping as sure as hell doesn't fix burnout.